Hi, I'm Shana, a nurse from NUH. In this video, I'll be sharing information about percutaneous endoscopic gastrostomy tube or a PEG tube with you. A PEG tube is a feeding tube that is inserted into your stomach so that milk and medicine can be delivered directly into your stomach. It is needed for those who are unable to swallow or eat normally through the mouth because of a certain condition, such as Parkinson's disease, motor neuron disease, or head and neck cancer. A PEG tube is placed through the skin and stomach wall with the aid of an endoscope. It is a short procedure that is usually done under moderate sedation. Typically, you will need to stay for at least 1 day in the hospital after the procedure. During the stay, our healthcare professionals will train you and your identified caregiver on how to care for the PEG tube. After the procedure, you may experience some pain from the incision or cramping from the gas buildup in your digestive system. But this should go away after 1 to 2 days. Your doctor will advise you when you can start to use the tube after insertion for feeding and medicating. Here's an external bumper which goes around the tube to prevent the tube from going further into the stomach. There will be 15 to 30 centimeters of PEG tube that comes out from the incision site. At the end is a balloon to anchor the tube inside the stomach, which you can't see. Now, I'm going to show you the right way of feeding and medicating using PEG tube. For milk feeds, please follow the regimen prescribed by your dietitian. You should only use commercially prepared formula. Do not use your own homemade formula or add any of your own supplements, as it may increase the risk of bacterial infection or lead to blockage of the tube. The milk should be at room temperature during feeding. The patient should sit at an angle of 30 to 45 degrees during the milk feed and continue to be in this position for 5 to 10 minutes after the feeding. Before the feeds or medication, make sure you flush the PEG tube with 30 ml of water at room temperature and remember to do the same after the feeds or medication. Do not mix the milk and medication. Medication is the most common cause of tube blockage. During your hospital stay, your pharmacist will go through all your prescribed medication and advise you if any of them needs to be changed to a more suitable form that can go down the tube more easily and less likely to cause blockage. They will also provide advice on the correct way to handle the medicine when you're giving it through the tube. Medication should be given through the tube one at a time, and you should flush the tube with water before and after each medication. The pharmacist will be able to advise you the type of medicine to be given before or after the feed. You should wash the feeding syringe with soap and water to keep it clean. The answer is no. The PEG tube is not permanent. It can be removed when your ability to take food by mouth is regained. Following removal, the wound site will heal naturally. The PEG tube should be changed every 6 months, but your doctor or PEG nurse will decide on the specific interval. This change can normally be done in the clinic without the need of another endoscope. The answer is yes. If you find the length of the tube bothersome, you can consider a low-profile tube which sits at the skin level. It is easier to manage and there is a lesser chance of accidental tugging of the tube. You can discuss with your healthcare professional to learn more about this option. Hope this video has been useful to you. To find out more about post-insertion care of PUD tube, click on the link to the video or NUH website below or talk to your healthcare provider. Thank you and goodbye.